Today, we're diving into a really powerful force inside our own bodies, growth hormone. We're going to follow the entire journey of growth hormone therapy, from the very first questions someone might have, all the way to diagnosis, treatment, and what life looks like on the other side. So let's jump right in. You know, it seems like such a simple question, right? But the answer is this incredible biological story. And right at the heart of that story is one tiny but mighty chemical messenger, growth hormone itself. So let's start at the very beginning. Let's get to know this master builder inside of us. What is it? Where does it even come from? And what exactly is its job? Okay, so think of growth hormone, or GH for short, as a set of instructions that get sent all throughout your body. It's a completely natural messenger that tells everything from your bones to your muscles how to grow and how to stay healthy. And, while it's famous for what it does for kids, its job is far from over once you're an adult. So where do all these instructions come from? Well, they come from this tiny, pea-sized gland right at the base of your brain. It's called the pituitary gland. You can kind of think of it as the body's main command center for hormones. It's the factory that makes and ships out growth hormone to get the job done. And this is where you can really see that GH has a lifelong job. I mean, for children, its role is pretty obvious. It's what helps them grow taller and stronger. But for all of us, at any age, it's always working in the background, helping our bodies manage fat, keeping our muscles and bones strong, and even playing a role in our energy and mood. Okay, so we've met our hero, growth hormone. But now, let's get to the part of the journey where a mystery starts. What happens when that little factory isn't making enough of this crucial hormone? How would you even know something's up? Well, the heart of the problem is a condition called growth hormone deficiency, or GHD. And it's pretty much exactly what it sounds like. The body simply has a shortage of the growth hormone it needs to work the way it's supposed to. And what's interesting is that GHD shows up in two totally different ways. In children, the clues are usually things you can see, the most obvious one being that they're growing a lot slower than their friends. But in adults, the signs are more internal, kind of subtle, things like constant low energy, a change in body composition, or weaker muscles and bones. Now, this is a really, really important point, and it's often a huge source of relief for parents. GHD is a condition that affects physical growth. It has absolutely no impact on a child's intelligence or how their brain develops. So once those first clues are there, the next part of the journey begins, the investigation. See, doctors don't just guess. They use a whole series of specific tests to follow the evidence and get to a real solid answer. This whole diagnostic process is a lot like detective work, really, with each test giving another piece of the puzzle. It usually starts simple, just by looking at the growth chart. Then, a bone age X-ray can show if a child's bones are maturing more slowly than they should be for their age. Blood tests check for other things, like a protein called IGF-1, which is controlled by growth hormone. But the real confirmation often comes from something called a GH stimulation test. That's where doctors safely trigger the pituitary gland to see how much GH it can actually release. And finally, sometimes an MRI is used just to make sure there are no physical issues with the pituitary gland itself. With a diagnosis finally confirmed, the journey takes a big turn from investigation to action. The mystery is solved, and now there's a clear path forward: treatment. And the solution, in concept, is actually beautifully simple. You just replace what's missing. The treatment is a synthetic or man-made growth hormone, but it's biologically identical to the stuff our bodies make naturally. It's usually given as just a small, daily injection right under the skin. And the impact? Well, it can be pretty dramatic. It's really common for a child to have a big catch-up growth spurt in that first year of therapy, sometimes growing 3 to 4 inches, maybe even more. Now, of course, every person's journey is unique, but that initial progress can be so encouraging for families. The super important part of the daily routine is just rotating the injection site. It's a simple step, but it's key to preventing skin problems like little lumps or dents from showing up in one spot. The usual spots, like the stomach, thighs, and upper arms, give you plenty of options to easily switch it up day after day. And that brings us to the final chapter of our journey, creating that new normal. So what does day-to-day life with growth hormone therapy actually look and feel like? Being successful with the therapy really just boils down to consistency, giving the injection around the same time every day. A lot of people do it at bedtime to mimic the body's natural rhythm, is absolutely crucial. And just as important is what not to do. You never want to skip a dose or double up, and always talk to the medical team before making any changes. Okay, I want to pause here for a second because this is a critical safety message. It's rare, but children on this therapy can have a slightly higher risk of a specific hip issue. So if a child on therapy starts to limp or complains about hip or knee pain, it's really important to call the doctor right away. And that's really the main takeaway here. The healthcare team is a partner in this entire journey. They need to know about any nagging side effects or concerns, like headaches that won't go away, any vision changes, or even if you just feel like you're not seeing the progress you expected after a few months. That open communication is everything. So when you step back, we've seen how a tiny problem in a tiny pea-sized gland can have such a huge impact on a person's life, and also how our deep medical understanding lets us fix it. It really leaves you with a powerful thought, doesn't it? How can understanding something so small, just a single hormone, lead to such profound life-altering changes?